Hello, I'm Brooke. I'm a NICU nurse here at Ascension Via Christi St. Joseph. Today I'm going to be showing you our baby's bed spaces and going over some equipment that you will see when you are on our unit. The first thing I'm going to show you is our monitors. Every baby will be connected to a monitor. They're connected with some cords, and then the cords are connected to leads that are on baby's skin. This way we can continuously monitor every baby's vital signs. On our monitor, the first green line here, that is picking up baby's heart rate. This blue waveform here is picking up the respirations. That's how fast or how slow our babies are breathing. And then the yellow bottom here is the oxygen saturation. These monitors have high and low limits already set on them. Anytime the baby goes outside of those limits, it is going to flash a red light, an alarm to let the nurses know that they need to come check on the babies. If a nurse doesn't come over right away, more than likely they are looking at that baby's vital signs on another monitor. But of course, if at any time you feel uncomfortable or would like a nurse to come take a look at the baby, just holler at one of their nurses and we will come lay eyes on the baby for you. Our babies here in the NICU are often hooked up to different lines or tubing. One thing that most babies here have is going to be an NG tube, which is a nasogastric tube that goes in the nose down into the stomach, or an OG tube, which is going to go in the mouth down into the baby's stomach. And that is how we feed our babies that are not yet ready to feed orally. With these tubes, there is going to be a little excess tube hanging here. So we just want to be careful that we aren't pulling on that tube because we want it to stay secure and in correct placement. Your baby may also have an IV line. So common places that we will have an IV is going to be in the hand, it could be in their arm, leg, foot, or even sometimes in their scalp. That IV is going to be connected to some IV tubing, and that tubing is going to be hooked up on our IV pumps here. Again, just be extra cautious that that IV isn't being pulled on, because if it does get pulled out, we will have to poke the baby and put in another IV. You will also see some babies that are on respiratory support. Our respiratory support is always over on this side of the bed space next to the oxygen blender. The babies that are on oxygen or respiratory support, they will have a nasal cannula that goes into their nose, or sometimes they will even have a mask that goes over their nose and mouth. With that, we just want to make sure that the oxygen and respiratory support stays where it needs to be and that the tubing isn't being tugged on. As we've gone over, our babies can be connected to lots of different cords, lines, oxygen. So whenever we are getting the baby out to hold or putting the baby back, we're just gonna have you have a nurse with you to help with that transition until everybody is comfortable working around and moving the babies. Here in the NICU, you will see some babies that are born prematurely, so they are gonna be on the smaller side. And you may see some larger babies that are term babies but still needed to come into the NICU for some extra help. You will also see babies that were exposed to drugs in utero. Those babies oftentimes are a little extra fussy, and while you're in here and if you're cuddling one of those babies, we are going to show you different ways to console those babies and comfort them. I am now going to hand it over to Claire, our occupational therapist.
Thank you, Brooke. As Brooke said, I'm Claire. I'm the occupational therapist that works on our NICU. I'm going to talk to you today a little bit about some of the developmental care we provide for the babies, as well as some stress cues and things that you can do as a cuddler to help the baby. We put quite a bit of emphasis on developmental care because that sets the tone for the baby down the road. The experiences that they have in the NICU are important for their further development. If you think about a baby that goes home, they are exposed to the smells of home, the sounds of home, the movement of home. Many of the babies that you will be seeing, as Brooke said, are drug exposed or premature. So in addition to coming into an environment that's very different from a sensory point of view than what they would experience at home, they also have some developmental issues just based on their prematurity or drug exposure. The first program I'm going to talk to you about is a program that we have for parents. It's called the SENSE program, and it stands for Sensory or Supporting and Enhancing NICU Sensory Experiences. You may see one of these at the bedside. It's for the parents, but we also want the cuddler to be adhering to some of these developmental guidelines as well. That would be based on the last menstrual cycle, and it talks about the different sensory systems. In addition to that, the parents have a handout, and this is something that also might be interesting for the cuddlers. It talks about stress cues that you may see with the baby. It talks about the baby's sensory system in utero as well as after the baby is born. It talks about some terminology that the parents may hear in the NICU. So it's also a good resource. In talking about the sensory systems through the SENSE program, one of the first ones that we look at is touch and just how the baby is able to handle touch. We want you to just make sure that you are giving a nice firm touch, not a lot of light moving touch on the babies. We want you to hold the baby securely. The baby may be wrapped in a swaddle, but just some nice kind of firm, relaxing touch. The next system is the hearing or the auditory system. That is one of the first senses to develop in utero, and we try to be very protective of the baby's sense of hearing here. So we're asking that you talk in kind of like a loud whisper like this. We don't want people to be real loud around the babies. We also encourage reading and talking to the baby a lot while you're doing the holding. We have these scent circles. We have the moms put those scent circles in her shirt, and then we put them in the baby's bed, and that way the baby can smell breast milk or just the scent of the mom. We switch those out about every 24 hours. So if you see one of those, that's the reason for that. Vision, that is also important. That's a later sense to develop for our babies. We do cycled lighting here. So during the day, the lights are on more. At night, they're off more, just to kind of get the baby used to that. That cycled lighting is very important developmentally for the baby and also for the families that are up here. So we also want you to be very careful about not having like bright light in the baby's face, your cell phone on around the baby. We just try to be very neuroprotective with that. The last area to talk about is movement or body awareness. And that is just, if the baby is unswaddled, the nurse may swaddle the baby, let the baby move around a little bit. Another thing to do is for you to just do some gentle rocking with the baby. You may want to hold the baby up here on your shoulder, and that's a nice place to do some just gentle rocking. You can hold the baby in side lying, or even sometimes like this, depending on the age of the baby, a little bit older baby, and just talking to the baby and just doing gentle rocking. Another area that I want to talk a little bit about is stress cues. We see a lot of stress cues with our babies. That's very typical for a premature baby. Some things that you may see are, this is a stop sign, and that's when the baby puts their hand up in front of their face just to kind of block out the input that's coming in. You may see a furrowed brow. That would be the baby just has a look on their face like they're very uncomfortable, they're in distress. You might see some arm or leg extension. You see this especially with the legs, so that the baby is just sticking their arms and legs out. Again, an avoidance. The other one is gaze aversion, and that is when you might be talking to the baby or looking at the baby and it's too much stimulation and the baby looks away and won't look at you. Other stress cues that you may see are hiccups, yawning, sneezing. Those can also be the signs that the baby is too overstimulated. And if that occurs, we want you to do some things to help the baby to be calm and organized. So some things that you might do are, you might do a grasp. That's where you hold your finger and the baby puts their hand around your finger. And you can do that with both hands. You can kind of hold the baby's hands in that way. That can be very calming and organizing for the baby and help them to regulate. We encourage babies to have their hands up by their face. Now, that can be difficult if the baby has an NG tube or an OG. We don't want them to pull those things out. But all the input that the baby gives themselves is really important. That tells us that the baby is beginning to self-regulate and have some ability to self-soothe. So you may do the hand hug, and that is where you just basically kind of give the baby a hug with your hands. You just hold them in a nice flexed position. You can also do that at the head and the bottom of the feet. You know, basically what we're trying to do is help the baby to feel secure. So we want to give the baby some containment, which you can do with your hands, or we do that with swaddling. And then we also want them to be in a nice flexed position, because flexion is a calming and organizing position for a baby. Sucking on the pacifier also encourages the baby to be nice and flexed. Again, a very calming activity. So in closing, I just want to thank you all so much for being cuddlers. It's a very important program. It really helps us to promote the developmental care that we want to do for our babies and to give the babies the best possible beginnings to have a very good developmental outcome. Also, if you have any questions, there will be a bedside nurse that is taking care of the baby that you're cuddling, or if that nurse is with another baby, you can grab one of the other nurses and ask any questions or any concerns that you have.